Hello, welcome. Let's see, as people are coming in, which they are not just yet. Okay, hi, welcome everybody. Thank you as you're coming in. Hi, I'm Jada Shapiro, founder of Boober, and I will talk a little bit more about myself and our guests today as we get ready to discuss pregnancy, birth, postpartum, lactation, all of it in the time of COVID. We have two experts today with us, so we're excited about that. But as we're getting started, while we wait for people to enter, if you could go ahead and drop into the chat, let us know how many weeks pregnant you are, or do you have a baby? How old are they? Where do you live? We always like to see who has joined us today, where people are from, and it also lets me know that you can hear what I'm talking about. So that would be fantastic. Are you out there? Where do you live? How pregnant are you? Or do you have a baby? Let us know. Hi, Alexandra. 29 weeks from NYC, which is where we actually all are-ish today. 22 weeks, Chelsea, pregnant, first-time mom in Houston. Welcome. Thank you for coming. Hey, Kira, 31 weeks in DC. Fantastic. It's always nice just to connect with all of you. Melissa, hi, 21 weeks and first-time mom in Long Island. Thank you so much for coming out today. And as you're continuing to chat, we're just going to throw up a poll while people come in as well, just so we can sort of see where you are in the pregnancy or postpartum. Hey, Anna, 20 weeks in New York City, first time mom, and dad's here too. Welcome. Nice to see you all. It's always fun to see where everybody is coming in from as we are just waiting a couple more moments. Hey, Betsy, 23 weeks, pregnant from Jupiter, Florida. Welcome. You know, even though we're all sitting together in our own places and not sitting in space together, which we love to do, we can feel, you can look and see in the chat, you can see that other people are having little humans along with you, growing their babies, connecting. Hey, mom and dad in Charleston, 17 weeks, the first baby. Hey, Dana from Chicago, Lincoln Park, 19 weeks. Wonderful. Thank you. All right. So thank you so much for taking our poll. We've got a lot of people from all different parts of the pregnancy, from 19 weeks or under. There's several people 20 to 25 weeks. We've got a few who are in the 26 to 35 weeks, and then a couple who are in that 36 to 42 weeks. So some of you are due very soon. We have a professional care provider here as well. So thank you all so much for filling that out. And all right. Go ahead and introduce ourselves. So my name is Jada Shapiro. I am the founder of Boober. Boober is a platform where expectant parents and new families can find all of their pregnancy to postpartum care providers like birth doulas, postpartum doulas, lactation consultants, mental health therapists who specifically focus on pregnancy to postpartum. We also provide lots of wonderful childbirth classes, such as, 3-hour class, a full 8-hour experience, not all at once. We teach prep for postpartum classes, infant CPR and safety, newborn care, kind of everything to get you prepared as you move through pregnancy to postpartum. I've been a birth and postpartum doula for about 18 years now, lactation counselor as well, and a mom and stepmom. So that is a bit about where I'm coming from. I'm also the founder of Birthday Presence, which has been providing childbirth classes and doula training, lactation counseling training for over 15 years in the city of New York. But now we are all, of course, in this pandemic, virtual and here to work with you in whatever way you need. And since the pandemic started, we've been running these seminars for people to really, especially with COVID, kind of understand what's going on and keep up with, how do I deal with being pregnant, birthing, having a baby, dealing with my newborn, all of that with the challenges of COVID. So I'm so excited here to introduce our two expert guests today. We have Dr. Jaqueline Worth, who's an OBGYN, and Dr. Hela Barhoush, who is a pediatrician. Dr. Jaqueline Worth has been an obstetrician for nearly 20 years and delivered thousands of babies, founded the practice Village Obstetrics, and is a co-founder and co-physician at Village Maternity, which is the collaborative physician midwife practice in New York City, mother of 2 young women, delivers babies at Mount Sinai, and is the co-author of The New Rules of Pregnancy. And Dr. Hela Barhoush is a board-certified pediatrician practicing in New York City at One Medical Group and a mom of 2 toddlers. She partners with parents to foster optimal health and development in children to help instill healthy habits related to sleep and nutrition from a young age, and also teaches group parenting education sessions, and offers easy to digest parenting tips through various outlets and social media. And we'll be posting how you can find all of us. I also want to thank Hatch, who is this fabulous maternity store that I've been working with for years, because it's really important to them to create community and education. I used to teach in person in the classes, and now doing lots of teaching virtually through Hatch. And also want to thank One Medical as well, which Helen will tell us a little bit about the membership-based primary care practice. So I'm going to have you guys go ahead and introduce yourself. So Dr. Worth, why don't you start?
Oh, well, welcome everyone. Thank you for joining us. You know, it's just such an honor and privilege to try to share what I've learned about guiding moms through COVID and pregnancy and birth in these very changing times. So we've been on the front lines and we've survived, we've made it, and I have a lot of good advice to give you.
Thank you. Yes, it's always a pleasure to talk this through with you. And Dr. Hela Barhoush, go ahead.
Hi, everyone. I'm Hela Barhoush. I'm a pediatrician at One Medical, as Jada has shared with you. I just wanted to share a few words about One Medical for those of you who aren't familiar with it. So we're a membership-based primary care group. We have over 90 locations in different cities across the US, and several in New York City where I practice. I'm based in the Chelsea office. For those of you in New York, it's located on 17th between 6 and 7. And really our goal is to make it comfortable, easy, and convenient and safe, given the times for the whole family to get medical care. And so if you've been to our offices, you've seen that our offices are very spacious, they're inviting, they're comfortable, they're really designed for the patient needs. So each of our offices has a nurture room for families to feed or care for their babies before or after visits. We also run on time. We stick to our schedule. So there's very little to no wait time and very little time spent in a waiting room, which is also nice during these times. One of the things I love about it is we really have more time that we can spend with patients, which is so important in pediatrics, especially in the early weeks and days when there's so many questions. We can really dive deep to address concerns. We're very tech forward. So we have an app for our members and through that app, you can get 24 hours, 7 day of care, 24 hours, 7 day a week virtual care through our virtual medical team. You can also see your providers virtually if the visit is appropriate to be done virtually. Through the app, you can also book appointments, you can retrieve results. There's a direct messaging system where you can contact your provider. And so, check out our website. You can see all of our different locations, read the bios of the providers in your local office, and find someone that's a good match for your family. And if anyone has any questions, I can share my personal email address and you can feel free to reach out.
Awesome. Thank you so much.
I'm a One Medical patient. I can attest to their, I mean, not pediatrics, obviously, but the internal medicine, and it's a great practice. So definitely, take a look at it.
Awesome. Thank you. So let's jump in. I want to tell all of the people listening here, if you have any questions, please drop them into the Q&A. This is really for you and your personal experience as well. So any specific questions that you might have about preparing for, continuing through your pregnancy, having a baby, birthing practices, lactation questions, postpartum questions, family visiting questions, all of those, throw them into the Q&A and we will definitely address them. So I did want to get started today talking about vaccines, because we've heard so much about the COVID-19 vaccines. Sounds like one just got approved and we should be soon beginning that process. We've got a lot of questions that have come in around whether or not or how were vaccines, if at all, tested on pregnant people or lactating people, and what are the recommendations around, you think, if you have a pregnant patient right now, would you be counseling them to try and get a vaccine? What about the people who are nursing? We would love to hear from both of you on that.
Well, I'll jump in first. The vaccines have started to be shipped across the country today, which is just an amazing feat of science and expertise. The emergency use authorization that was done for the Pfizer vaccine allows pregnant and lactating women to receive the vaccine. So even though they were not included in the testing population, they're allowed to get it. This is maybe a technicality, but what I would say to the moms on this panel is the good news and the bad news is you're most likely not first in line. The first in line is residents of long-term care facilities, although there may be some question about that. I was just reading something. And then also healthcare providers. So you will have the chance to observe, there are a lot of healthcare providers, there are a lot of nurses and doctors that are pregnant and lactating. And so those nurses and doctors will have to decide when their hospital offers them the vaccine, do they want to take it? I personally I'm not pregnant, but I'm going to take it the minute they offer it to me. And so you as a mom will be able to, see what happens to them. If they have complications, if it doesn't go well, you're going to have some advance warning and then might have some additional. So there's going to be a time for you to make a judgment by the time it's offered to you about whether it appears to be safe in pregnant and lactating women. That's what I would say.
Thank you.
Yeah, so I, echo a lot of what Dr. Worth say, but again, this really is just tremendous that we're at a point where we were able to develop a safe and effective vaccine in such a small amount of time. And I think it's just really important to realize that even though it was done in a short amount of time, the technology that they're using, this mRNA type of vaccine, has been in works for years. And so the technology has been there. So you shouldn't have the concern that it's unsafe because of that speedy, warp speed that can kind of raise alarms, but it really has been studied for a very long time. And also, traditionally with vaccines, when there are adverse effects, they tend to be in the first days to weeks after given a vaccine. So there's a common, question that comes up is we don't have long-term data. And it's true, we don't have long-term data. But if we think back to, vaccines that we've used in the past, the side effects that come up that are severe usually are in the beginning, and the ones that are later stage are very, very exceedingly rare. And I would expect that to be the same with this vaccine. Again, when it comes to pregnancy and lactation, like Dr. Worth say, you have time to observe, like we have done with everyone who's gotten it in the first phase 3 trials of Moderna and Pfizer. So fingers crossed it's safe and effective. And I will definitely be getting it as soon as I'm offered to it. And I think, as a pregnant woman, you should be educated and informed and be empowered to make that decision for yourself, and feel comfortable speaking also with your provider about that.
Thank you. So I did want to address, the other question a lot of pregnant people have in terms of that it seems not that you're necessarily at more risk of contracting COVID as a pregnant person, but that if you are to contract it as a pregnant person, that the effects may be more severe. Can you speak to that, Dr. Worth, a little bit, just as we're starting to talk about that? Yeah.
Sure, absolutely. We have learned that when there are serious complications in COVID patients that are pregnant, it's always in the 3rd trimester. It's always at the end of pregnancy. And so what I've been advising my patients is in the 3rd trimester, which you can identify as, after you do your glucose drink, after you drink that sweet drink and they check your levels for gestational diabetes, that's the 3rd trimester. And from that point on, I would say whatever you're doing to stay safe, just do more, just do extra, stay home more, whatever it is that's your level, increase it at that point. And that's what I would suggest, because that's where you are most at risk if you were to get COVID.
And speaking of that, since we have a pregnant healthcare provider who just chatted in about, I will be offered the vaccine, would you recommend? So let's address that. I know you spoke slightly to that, but as a pregnant healthcare provider, since we do have a lot of pregnant healthcare providers who often come to these talks, and pregnant essential workers of all sorts, can you speak a little bit to that what should we do if we're on the front lines and working vaccines, try a different job within the job, not a different job altogether, I apologize for that, but a different role if possible. Can you speak to that a little bit?
That's such a tough decision. I think that's something that you should individualize with your partner and your doctor or midwife, because it is a risk to do things first. There's no question about it. And if I were pregnant in the 3rd trimester and the vaccine were available, I truly don't know what I would do. I don't happen to have any patients right now who are pregnant healthcare providers in the 3rd trimester, so that's not a real question for me yet. I think speak with your partner, talk to your doctor, and just make a decision based on your best judgments. I mean, I think I would take it, but I can't say for sure what I would do. I know I would take it not pregnant.
Right. it's a really tricky time to be making those decisions. I know. Yeah. And continuing on that, in terms of is there any more information about pregnancy and transmitting, the vertical transmission to the baby? Do we have any continued thoughts on that? If you could just both share perspective, any higher risk to the baby?
Dr. Barhoush, what are you seeing? Anything new on that?
In terms of pregnancy, so perinatal transmission, yeah. So, I don't think there's evidence right now that there is perinatal transmission. There have been cases reported where shortly after birth, babies have tested positive for COVID, but it's kind of unclear. They don't know whether the baby contracted that during the delivery process, before or after. So,
and those babies do well, right? Those babies.
Yeah, and then in terms of, COVID with babies, the majority of newborns who've had reported cases of COVID have fared well, have had mild disease, if any symptoms. Some have been asymptomatic, but there are a handful of cases. It is rare, but there are cases that have led to more serious illness. Thankfully, mortality is very exceedingly rare, though.
Yeah.
So, when I think about newborns and COVID, I really treat it like any other infection. So the flu or any other virus in the newborn period, when newborns are really still developing their immune systems and they're not vaccinated yet, they get vaccinated at 6 to 8 weeks. Any infection that they get is considered serious because, they're newborn. So I treat COVID like any other infection.
Well, let's back up a little then, talking about at the moment of birth, actually, because I think a lot of people want to understand A, the protocols around birthing, and then B, the protocols around, let's say, if I test positive. And I would love for you to address this, Dr. Worth, in terms of how you're approaching it, at least at your hospital. And are you testing everybody when they arrive in labor, or how is that working? And then if somebody does test positive, my understanding is now that we're not separating babies from birthing parents directly, like we may have been in the beginning when we had less information, but I would love to hear your take on that, please.
Sure. So, we're currently having a surge in New York City and all across the country. So, but the protocols haven't really changed recently. So essentially at my hospital, which is Mount Sinai Hospital, the main campus on 99th and 5th, every pregnant person who's admitted in labor and every partner and every doula are tested on admission for COVID. And those tests take about 8 hours to come back. The precautions are pretty universal now. The staff are all required to wear N95 masks, which are those sort of duckbill masks, and eye coverings for all patient encounters. Everybody's tested. Most people are negative, but the positive rate is real and substantial and increasing. So when somebody is positive, in the cases of my patients, it's mostly identified after delivery because my patients tend to come in labor. If you're induced, you're tested before your induction, so you will know ahead of time whether or not you're positive or negative. The universal precautions are the same. The patient wears a mask, the partner wears a mask, the doula wears a mask. And then if you're positive, your room is identified as COVID positive, and you would then, there's a technical medical term, you're put on, special precautions, meaning that people coming into your room have to wear, in addition to the eye shields, have to wear a paper gown, and you're advised to wear a mask when you're breastfeeding your baby so as not to spread droplets to your baby.
Thank you. And if you want to add on to that at all, Dr. Barhoush, if you have a newborn, you have been tested positive, right? You were at the hospital, you've gone home. In general, what are the precautions that you would be recommending to somebody?
Yeah, so I think the big question comes up as to whether it's safe to breastfeed if the mother has COVID. There is no evidence that COVID can be transmitted through breast milk itself. So, the AAP and the CDC and myself encourage women who choose to breastfeed, who are comfortable doing so, to go ahead and do that, use it with safety precautions in mind, because we really, we all know the benefits of breast milk, the immune support that it provides newborns. And so the safety precautions, as Dr. Worth alluded to, is basically masking during the breastfeeding act and making sure there's good hand hygiene with soap and water before and after breastfeeding. And then to the extent possible, when you're not breastfeeding, having, if possible, 6 feet of space between you and the baby. And whenever you're closer in contact, always keeping a mask on. If there is someone in the house who's young and healthy and who doesn't have COVID, having them kind of be in charge of the caretaking to the extent possible is also helpful to reduce risk. And then if parents aren't comfortable breastfeeding, if they choose to pump or give formula, whenever you go through the pumping process, it's kind of the same thing where you want to make sure you're wearing a mask and washing hands before and after during pumping, and making sure between each pumping session, the tubing and pump parts are properly cleaned with soap and water, and then having a caregiver who doesn't have COVID, if it's possible, feed the baby the express breast milk.
Yeah. I've heard some people recommend washing the chest before feeding, but I don't hear it very frequently. Do you have any thoughts?
CDC doesn't, say, they don't list that, but really any sort of like surface decontamination is going to reduce risk and be helpful. So it certainly won't hurt. Okay.
Seems like a real challenge to do that every time. I would.
Yeah. And that's, I think hands, anything that's going close to the baby's mouth and nose is really what you want to, and also touching your hands onto your breast would be, how you can contaminate. So if your hands are clean, then that should suffice.
Okay. Great. Thank you. And then going, I guess, backtracking it again back into the hospital, Dr. Worth, I know that in the beginning of COVID earlier, we were having people try to leave the hospital as quickly as possible. Then I know, at least in New York, when the rates went down, it seemed that people were staying longer than 24 hours. It was going back to 48 hours. What are you seeing right now as the general time of discharge from the hospital, for you at least?
Sure. So, I can only comment on the hospital that I work at, but the since COVID started, the recommended time to discharge for an uncomplicated vaginal delivery is now 24 hours, just in order to minimize exposure, just to minimize exposure to other people. And most of my patients are eager to leave in 24 hours. And if there's some reason why they want to stay, then of course I have them stay longer.
Okay. So, it sounds like, and again, for people here, we know you're all from many different locations, and we do encourage you to talk to your midwife or doctor to find out the current protocols. Those of you, I know some of you are due not for 20 weeks, right? So if you're due very soon, then you definitely do want to check in about your protocols. If you're not due for quite some time, I would encourage you, if possible, to lessen the stress or questions around it, because the protocols are changing constantly. We're always adapting and shifting. And, I think one of the things we talk a lot about in our childbirth classes, like if you were to come to Boober for one of the classes, we do pain relief classes and childbirth education. We certainly are addressing kind of current protocols depending, but of course by location, it's always going to change. And that's just one of the things we encouraged, check in. Part of the education process is starting to allay some of what's going on in our brains, wondering. But I would just also wanted to address the mask, as you were saying, that most people, what if somebody tests negative? Is the protocol still that they would be wearing the mask? Should we be preparing most people to, as typically in our classes, we are preparing people to practice wearing the mask at home, get comfortable with it, because you may likely be wearing it, but I would love to hear from you what your experience is with that.
Sure. Everyone in the hospital is wearing a mask, all doctors, all nurses, all patients, all partners, all doulas. If a woman is in active labor and pulls her mask down and has tested COVID negative, probably nobody's going to remind her to pull it back up. But I mean, basically everybody is masked, because, the standard for COVID testing, if there's suspected COVID, is actually 2 negative tests. And so, an individual negative test is not necessarily completely reassuring.
Thank you. Yeah. And so anybody here, like if you guys all want, if you have your phones, please feel free to pull them out. If you are on Instagram, follow us at our various places. I'm going to drop mine into the chat. I dropped at Dr. Hela Bar as well, and at the New Rules of Pregnancy. as well as at Get Boober, because we all, do a lot of current information on what's going on. We do teaching tips and tools. So I encourage you all to get on there, to follow us for these different kinds of informational little tidbits that we can give you along the way. That is our goal. I think here, part of why we're doing this, to help educate you and give you some tips and tools as we go, get through this. So somebody just asked a question. I was hoping to use a doula, but our hospital has recently downgraded their labor and delivery policy due to COVID surge to only one support person in labor, which will be my husband. Do you have any suggestions for adequately preparing for birth, knowing I won't be able to use the support of a doula as expected? Yes, thank you.
Sure. Yeah, absolutely. I have lots to say about that. So, when COVID first happened in, March in New York City, I gained a lot of experience of working, 99% of the patients in my practice use a doula. And so it was devastating to me and my patients to not have their doulas come to their births. And so we immediately shifted to virtual doulas, because what else are you going to do? And, so my opinion is having a virtual doula is not as good as having a live doula, but it's way better than not having a doula at all. And so if your only option is a virtual doula, I did many, many births in March with virtual doulas, and I was astounded at how incredibly supportive and, how well it worked in difficult circumstances. So that would, live is better, but virtual is great if that's all you can do. And Get Boober has, virtual doulas. Jada can refer you to a lot of sources for that.
Yeah, I just dropped into the chat, actually, a blog post we wrote about how virtual doula can help, if that is something, because I know you were thinking about a doula, and we definitely have a lot of people who are currently hiring people in person, knowing everybody's contract at this point, like any doula you hire for in person, wherever they are in the country, should have in their clause, what happens if it shifts to that I'm not allowed to come in, I'm going to still support you, right? And to be perfectly honest as well, and I've been a doula for a very long time, and I own a company that matches people to doulas. And I thought, how is this going to work out virtually? Like, what are we going to be providing? And do I want to be telling people that they should get a virtual doula? I want to know what the value of it is. And now that we've been doing this for 9 months, and I have, we've heard feedback from so many people who actually did work with virtual doulas. I agree with you, Dr. Worth. It's, of course, in person is if we can, but when we can't, the support is so amazing coming from a virtual doula. We can either, I found that it goes different ways. Sometimes people have their screen open and they do this entire time in a FaceTime like this, or in a Zoom, where I'm able to, talk to you, kind of bring that calming voice, kind of tell you, oh, if you're leaned over the bed, I might say, hey, prop up a pillow there. And I might suggest to your partner, I'm going to show them this like 2-thumb technique in the lower back. And I'll send a picture as well in a little video, so that you can really have a whole lot of tools and tips that I'm throwing at you as a doula. I've also seen some people not want to be as much screen-based, or sometimes when they get to the place of birth, to the hospital, they'll put on their earbuds, and the doula, we're kind of, just able to gently talk them through. And it's like you have this person in your head who's calming, who's providing tools and tips and techniques, can even talk to the doctor, and I know, Dr. Worth, you had lots of doulas kind of on that cell phone with the bendy arm, right? Like,
yeah, I would just say practice the tech, whatever it is, you're going to be stressed when you're in labor, right? So you don't want to be doing something new for the first time. So practice with your doula. If it's going to be a virtual doula, practice with your doula the way that you and she want to communicate best, whether it's earbuds or a screen. I've seen all different kinds of ways. I think whatever works for the two of you is what's best.
But I do also want to say that it's possible that you choose not to hire a virtual doula, and that is completely also fine. So the question you asked, what the person asked was, what other things can I do? And I think that if you'd consider, coming to a childbirth class is one way. I also do these 1-hour drop-in $15 pain coping classes. Like, you can just come to an hour of pain coping class, and I'll teach you tons of tools and techniques and tips that you yourself can practice. Some of them are mental distraction techniques. Some of them are physical techniques. Some of them are positions that you might choose. Some of them are acupressure points. And also, if you have a partner, it will teach your partner a lot of great things to do as well. There's also a great book I'll drop into the chat called The Birth Partner, which is great for partners. to have a whole bunch of tools and tips that they can, use. And I used to bring that book when I was a new doula. I brought it with me all the time to try and help people through labor. So lots of things that you can do. Thank you for that question. All right, let's shift a little for a moment into COVID protocols for family visiting, because we have a couple questions that have come in on that. So if family's visiting shortly after the baby is born, are you recommending full quarantine, a testing protocol, time periods? Those are some of the questions that have been coming in.
Dr. Barhoush, take this one.
Sure. I can take this. It's a tricky one. So, there is no one answer to this. I think this is a decision that you really have to think about and have know how to think about, which I can guide you with, and decide, with your family, what you're comfortable with. And so I think the way to approach it is first think about, like any decision, the benefits and the risk, right? So when we think about benefits of a visitor, if you for me, we know the newborn period is a risky period, even without COVID. And so I generally like to minimize exposure and visitors during the newborn period for the first 2 months. But when we think about benefits, if this visitor is going to provide you support, if they're going to give you the break that you really need, if they're going to help you with meals and so forth, then, and we know how much support we need, especially nowadays after giving birth, then it may be worth it. And so if it's a visitor that is going to come and pop in and say hi, and then 10 minutes after they leave, you're not going to think about it again, I'd be a little bit, more cautious with that. And then when we think about risk, there's a few things to think about. So every visit doesn't carry the same amount of risk, right? So if we think about a visitor who has been, fairly cautious in their own personal life, quarantine, I think about grandparents is the first thing that comes to mind. And they've been you're comfortable with how they practice and for at least 2 weeks or so before they come to visit you, then you can maybe be more comfortable with them coming into your house without masks and so forth. If it's a visitor that isn't as cautious, you want to think about that and use your judgment. And if you if you decide you want them to come into your house and there may carry more risk, then thinking about mask wearing and distancing when possible may reduce that risk. So, you want to think about the benefits, you want to think about the risks, and really come to a decision, as a family, as what you're comfortable with. And yeah, it also depends on where they're coming from, right? So the prevalence of the area that they're coming from definitely will affect the risk level and the route they're taking. So if they're, flying versus driving. So there's a lot of nuances to think about. And it's definitely something you should speak to with your pediatrician, with your provider, to discuss those nuances and differences.
Yeah. Thank you. It is really, it's a lot for people to think about. And I think that one of the things we've seen through the course of the pandemic is the more you start talking about it now, really start to think about what is the plan, the postpartum plan, we teach this, I teach a class called Prep for Postpartum. And one of the things I really talk about is, can you start having these conversations now? Because it's uncomfortable. Sometimes there may be certain people in your family that you don't feel are taking the virus or COVID as seriously as you are, and they may not be the best fit for your family in the beginning, even if you love them and care for them and want to introduce the baby. And so, and I think with all things with new babies, it's where people on the street will tell you how you should care for your baby, or that they're cold or that they're hot. A lot of this is about checking in with yourself. And Dr. Barhoush, do you find do people ever use you in the sense of well, my pediatrician said that I can't, are you comfortable with that?
Totally. Yeah. I going back to where you started of talking about this early, I think, make these decisions before you're in the position where you have to make them. So think about it, talk about it, and be comfortable. Sometimes people just need to be told things. And if they hear it, you'd be surprised at them actually being okay with it. And if they're not okay with it, totally blame your pediatrician. That's what we're here for anything. Stomach sleeping, tell them your pediatrician said so. A lot of grandparents don't buy in until they hear it's medically recommended. So yeah, totally.
Right. And would you say the same, Dr. Worth? for pregnant
Well,
people?
I've been following one of Dr. Fauci's recommendations, which is to quarantine for 5 days before someone comes over and then test at the end of 5 days. And then obviously that's not perfect, but that's a pretty good, pretty good indication that that person isn't going to get you sick.
Yeah, I think the number they throw out there is 5% with that. So it can miss 5% of positive cases if you test 5 days or later, which is pretty good.
Right. So if somebody were feeling stricter, would you say, 14 days? If somebody's really feeling strict, if they're not doing any test, then you would go 14 days?
Yeah. So close to zero, I think I'll give you numbers, is 0.1%, I think they say, is if you're 14 days quarantine without a test. If you do 5 to 7 days and a test, it drops the number down to 5% that can be missed. And then if you go 10 days without a test, these are from the CDC recommendations. They recently, recommended this to shorten the quarantine. So 10 days without a test brings you down to 1 to 2 days.
And
so 1 to 2% with.
Okay. And what are we discussing, PCR tests or rapid tests? Can you clarify?
Yeah, so actually it didn't specify in the studies. So that's why it all gave a range, because with the antigen test, it is less, the rapid tests tend to be less sensitive, so can miss more. So you're going to be on the higher range of that, of missing a test. But that's why there are ranges. And it can be either test. The issue with the PCR test is there is a lag in getting the results. So it tends to take 2 to 3 days. And so if you take it on day 5, you'll get the results on day 7. So you're waiting. Whereas a rapid test, it's a usually 15-minute to hour turnaround. So you can, obviously get it quicker, but it may not be the most ideal test.
But that also means that if you do a PCR after a 5-day quarantine, that it would probably be better than the 5%, because they're averaging in the 2 types of tests in that 5%, right?
Yeah.
So, and to kind of piggyback on this discussion, a lot of questions we get asked about if somebody went to the hospital to give birth and then their parents, who are the grandparents of the baby, are coming, does the birthing parent need to quarantine in terms of protecting the grandparents who are higher risk? Can we just talk about that a little bit?
So initially I was quite concerned about that, actually, but we've seen, I'm aware of no cases of patients getting COVID in the hospital from staff or from other patients. My hospital is extremely good at isolating the patients from each other, and the staff is screened every day, and all staff are wearing N95 masks and eye shields. And I'm aware of no cases of patients getting COVID in the hospital. So I'm no longer worried about the pregnant woman or her partner getting the grandparents ill.
Thank you. Moving back into labor, because we have a question that just came in. If the mother or the birthing parent tests negative, but the partner tests positive, will they have to be separated? Will the partner have to leave, Dr. Worth?
Oh, goodness. Well, this is a question that we were quite worried about at the beginning of COVID, what to do about this situation. And I think the official answer was, it depended. The official answer was yes. If the partner is positive, he or she has to leave. But then it was qualified as, it depends where they are in labor. If the mother is pushing, then they don't have to leave. But I don't think it really came up very often. So, I mean, it's theoretically possible, but it's unlikely. I think if the partner's positive and the mother's negative, you would suspect that the mother was probably positive and needs to be retested.
Right.
And so he or she would leave and the mother would go home in 24 hours.
Right. And I think one of the things, and this kind of addresses the other person's question that I didn't say in terms of ways to stay connected, since a couple of you are asking this question, I do want to address that concern. And one of the things we've been recommending, and especially recommended earlier in the pandemic when this was happening more, and we know that partners at one point were even not allowed in for, I think, about 5 days, which then got overturned, is to think about how you can stay connected, whether that is through technology. So to have those extra chargers so that you can FaceTime your partner and have them set up to have these little bendy arm things that attach your cell phone literally to the bed, so you don't have to hold it and they can see. But also sometimes having partners record a little bit of something, talking to listen to, bringing something that smells like your partner, actually, to stay connected, because that smell can help you feel connected. This is unlikely. It's not been something that we've seen very much, but if there are ways to help you kind of feel that stay connected. And I think, what we always teach in our childbirth classes is the idea of how to navigate whatever comes your way in labor, right? And that's a big part also of doula care is kind of, we don't know exactly what's going to happen in any way, shape or form, always. And so kind of helping you navigate that place is part of what we do. So yeah. All right, so continuing on with visiting, do you ever recommend, so if somebody is flying in or is kind of in a higher risk place, I know that some people we've been working with will have their parents rent somewhere nearby and quarantine, if possible, or if they have some type, in New York City, we don't have as much separation in our housing as people sometimes who have houses, which many of you may, where they could have a family member quarantine separately in the house. Are you getting questions like that, Dr. Barhoush?
Yeah, definitely. Yeah. So, when you think of kind of risk on a spectrum, with the safest thing that you do isn't always the most feasible thing. So if you want to think about it that way, and you're doing the very safest thing, it would be exactly that, for them to come in and separate for 14 days. If that can't be done, which is, the case for a lot of people, especially in New York City, so there's a few different options. You can have them space in terms of keeping 6 feet space and wear masks for the duration of whatever quarantine time you choose, and have them not closely interact with the baby or the parents during that time. And then in terms of the time of the time of days, so 14 days would be the longest. Again, going back to the CDC change in recommendations in the quarantine period, this is, the case here, where you can test at day 5 to 7 and then break quarantine a little bit early, or go up to 10 days with or without a test if you can't do the full 14 days. So also taking into account, again, where they're coming from and the flight itself. So you want to always err on the side of caution, but it tends to be less risk if you're on a very empty flight and there's not a lot of exposure, versus they're oh, we had a full flight and there were people close to us, kind of taking all that into account as well.
Right. And speaking of kind of moving around and traveling, thank you for kind of clarifying that. This is less traveling, not far travel and not visiting, but what about visiting as the pregnant person or the parent, visiting your doctor's offices? Now, I know earlier in the pandemic, when we were in a strict lockdown, visits were remote for a lot of people. I know that has shifted. I would love to hear from both of you. What visits for pregnancy are you doing remote, what are in person? And then the same with the new baby. I guess let's start with Dr. Worth and just hear about that. And if you are doing remote visits, what kind of things do you need to have at home?
Sure. So, in the past week, we've been advised by Mount Sinai that we're going back into some of the surge precautions where certain ultrasounds are being minimized. So, for example, what I mean by that is there are a series of ultrasounds that are done in pregnancy. One of them is the anatomy scan. You'll probably all remember that, where you look at all the structures in the baby, and that can be done in either 2 parts or 1 part. And so during the height of COVID, and now, it's being recommended to us that the anatomy scan not be done in 2 parts, but just be done in 1 part, and that the growth sonograms be spaced out and be less frequent. So there's certain sort of, and potentially even not doing the nuchal sonogram, just doing the NIPS blood test. So there's certain things that have been identified as ways to minimize exposure to other people based on testing. And then in my office during COVID, we alternated visits, offering telemedicine with every other visit. I haven't gone back to that. I feel as if my office is very safe. There, we never have anybody in the waiting room. The rooms are ventilated and we're all wearing N95 masks. But I certainly would offer to any patient who wanted to do selected visits by telemedicine. It's completely fine with me. I think that's always an option.
Yeah, Dr. Barhoush, what are you doing with your little patients?
Yeah, so it's a little bit different in pediatrics, especially in the first year of life, and especially in the first weeks of life. So, for our pediatric well visits, there's so much of what we're doing that really can't be done virtually. We're measuring growth, and some of it, some people we wait, you can usually get done at home, but head size and length, it really is tricky to get an accurate measurement in the home. So that's tricky. We're doing full physical exams to make sure there's nothing we're missing and nothing is changing at every well visit. In the early days after going home from the hospital, we're checking for jaundice, and that's done on a physical exam, but oftentimes it has to be done through a test as well. And then, in the first year of life, most of the well visits require immunizations, which obviously we can't do virtually. So, and it really is about preventative care. So I think, I really encourage parents to, well visits really should all be done in person. And again, like Dr. Worth said, I totally echo with that. We have seen over the course of the last few months that the safety precautions that we're taking in offices are working. Like, I haven't heard of any cases of spread within our office or patients, anything like that amongst adults and pediatrics. And, I can speak on behalf of One Medical and the precautions we take. Again, like Dr. Worth, we have well-ventilated rooms. We're all in N95s. Pretty much there's no exposure with other patients because you're really not in the waiting room. And it works and it's safe. And so I would urge parents not to feel reluctant to come into well visits, because it really is all about preventative care and you don't want to miss anything. With that being said, there are some things that can be addressed virtually. So, if it's a counseling visit where you have questions about, sleep or feeding or whatever it is, and there doesn't need to be a physical exam associated to it, I definitely offer it. For rashes or something that's visible that we can see in a picture, I definitely offer virtual visits. And then from there, if we feel like it's something that needs to be followed up with the in-person visit, then we would go from there. So yeah, for well visits, definitely try to get into your pediatrician. It's really important we don't miss those.
Okay, thank you. And do you find, this kind of piggybacks on it, although it sounds now more like we do want the patients to come in. So I know earlier in the pandemic, there was a lot less of that, but I guess there's always the possibility in a lockdown, right, that you would possibly shift some of those visits. I'm just curious.
Yeah. So how we treated it, and so it's changed a lot. It's evolving. At the beginning, we really didn't have all the safety precautions and the policies down. And now over time, we have we can look in hindsight and see that the things we're doing actually work. So I think we would be less likely to lock things down. But how we treated it, we didn't want to miss vaccines and things that were really important. So we had for well visits at the height of the pandemic in April, May, June, where patients would come in for their immunizations and a quick physical exam. And then we would do the rest virtually, where we would talk and do the counseling and take our time so it didn't feel rushed. But I can't imagine at this point they would change what we're doing because it's really working. But if families had reluctance, we can always, we have the technology and the resource to always offer a virtual visit for the at least speaking portion of the exam.
Thank you. And in terms of going outside with your newborn, walking about, being about, can you speak a little bit about, because newborns can't wear masks, right? Can you?
Yeah. So, fresh air is important. Getting out there and getting walks for all of our mental health and health is very important, as we all know. And when I think about, kids being exposed and newborns being exposed, it's really from other individuals. It's not from if you're outside in open air and there aren't many people around you. So open air walks where it's not in a densely populated area, I'm fine with. And this is, the same pre-COVID. If you're in a city and there are some people around, having some sort of barrier can be helpful and reduce risk, like a canopy over the car seat or having the babies in a carrier on the chest. So I worry less about outdoor time in that manner than I do, like if you're in a crowded place and there are people around and you can't maintain space, and having actual visitors, or, you're going out and someone's in close contact with your baby.
Yeah, and anything, Dr. Worth, in terms of just pregnant people getting out, the same thing. Can you offer that advice of how to be out and about if that's possible, or be outside? I think the fresh air point that you make, Dr. Barhoush, is so important, because I think we've seen, certainly mental health has shifted a lot for many of us, and has in some cases when we're pregnant and feeling isolated. I do want to speak to that. That is part of why at the beginning of the pandemic, we quickly launched the mental health support services that we have at Boober, where you can find a therapist who specifically focuses on pregnancy to postpartum. I would also encourage people, even if maybe online groups don't feel like the way to go, I would encourage you to try it out every now and then, because talking to other birthing parents or moms, or dads or partners who are going through this at the same time with you, if you're not able to go to a group because it's too close quarters and it can't be inside. I mean, if you can do a socially distanced walk, that can be nice, but it's really hard to gather with the group of 12, people that is not able, you can't do that right now. So I think that can be a really lovely thing for people to know about. But I also just wanted to let people know that you can always talk to your OB, right? Your pediatrician, your doula, your friends. The best way to get support and help if you are struggling with your mental health or you're not feeling like yourself is to tell somebody, and we can direct you into the right.
And as a pediatrician, you're really in the first months after giving birth, you're coming in to see us frequently a lot, and you tend to have a relationship of continuity. So I encourage families and moms not to think of kind of to normalize it and to realize that it is very common and that we should be asking. And if it's not being asked, you should feel comfortable coming to us because we can really provide resources and the support that so many moms need.
I guess I would just add that one of the things I see in my patients is that when you've been able to almost perfectly isolate yourself, essentially not leave the house except for your medical visits, which is what I see for many of my patients, I think it can be really terrifying to leave the house, the elevator, the walk outside, and so I would just say that we healthcare workers have learned through necessity because, I continued to go to the office every day through the pandemic and to the hospital every day. We were one of the, OB was one of the essential services that was not shut down, that, these basic precautions, I don't know anybody that got sick. And so you really can go in your elevator, go outside, go for a walk, wear your mask, stay away from people, but it's safe and it's healthy. It's mentally healthy, because to be home and terrified is not good for you. And I don't think that's so true anymore, but I definitely was noticing that dichotomy in patients that would tell me that they had been nowhere but my office.
Yeah. Thank you.
Masks work.
Yeah, masks work.
Right. Thank you. What about, there's a couple of people asking questions about babies or older children that they have in daycare. Some people have an older child and they're pregnant right now. Can you speak a little bit about that?
Yeah, sure. So, again, the recommendations and what we suggest doing hasn't changed pre or post pandemic. If your older child is in daycare, there is a higher risk that they can bring germs home. So there are a few things you can do that can be helpful to reduce that risk. So for one, whenever they come home from being in daycare, total change in clothes, wash hands really good with soap and water, and wash face as well, bathe if that's possible, not always possible. And then in the baby's first 2 months of life, trying to avoid the older child touching baby on the head, face, around the nose or mouth, because that's really how contamination transmission happens, is by germs going into the orifices, which are the nose and the mouth. So no kisses. And if you want to make them comfortable being close to the baby and still showing affection, encourage kissing on the toes, things like that. And then once your baby's vaccinated, once they're 2 months, you can start to kind of, get more normal. But yeah, those are my suggestions. Yeah.
Okay. Thank you. Yeah. A lot of people have those questions.
No, I have two. I have a 3-year-old and a 16-month-old. So I know, and the older one is always in school or daycare. So it's not always easy. I know it's easier said than done. But if you just start from the beginning and kind of make it rules in the house, it does tend to make it easier. And then the other thing, sorry to add, is if the older child has symptoms, is actually sick with any runny nose, congestion, fever, then at this point, I would do total separation, because we really don't know unless there's a test if that's COVID or not. And even if it was something else, you don't want to risk in the first 2 months of them transmitting. So total separation with symptoms.
Thank you. Can you speak a little bit about symptoms, that we would see in a newborn or child?
Sure, with COVID.
Like how would we know I should call you?
So it's in the newborn periods. So first of all, children somewhere between 20 and 40% can be totally asymptomatic and not have any symptoms. If they have symptoms in the kind of toddler childhood range age, I'd expect symptoms to be like any other virus. So cough, congestion, runny nose, so mild symptoms, and then they can extend to more moderate symptoms like cough and fever. In newborns, symptoms may be a bit different. So generally when newborns get sick with infection, first and foremost, what we're looking for is fever, lethargy. So being like not waking up for feeds, being kind of listless, not as, perky when they're awake feeding, and poor feeding. They can also get the upper respiratory congestion symptoms, but the first three are the things I'd be looking out for.
Okay, thank you. And actually for another healthcare worker question, if somebody, a pregnant person is living with a healthcare provider or essential worker, Dr. Worth, how, and then I guess later for Dr. Barhoush as well, in terms of the baby, how are you recommending families take care of that, deal with that situation?
Say that again. If you're living with an essential worker.
Yeah, if you're living with an essential worker or a healthcare worker, right, as a pregnant person, what precautions are you taking inside of the home with your partner?
Mm-hmm. Again, this seems so much less fraught and charged than it did in the beginning. I think just basic precautions. I mean, ideally, I have a new patient who works on a TV set, and she told me that she is tested 5 times a week, if you can believe it. So I think, we doctors don't have access to that, but, I think testing as frequently as possible to assure that as yourself that you're negative, and changing your clothes and washing your hands, and just, scrupulous care to really keep that mask on the whole time you're in your work environment, and be aware that, you need that the risk is really eating and talking. So you need to not eat and talk in the presence of other healthcare workers, because that is really where the risk could occur. So eat, don't talk without your mask off, and eat by yourself, as sad as that is. And then if you do that, and then when you get home, you change your clothes and wash your hands, I feel very satisfied with that.
Thank you.
Yeah, I feel the same. I think in the beginning there were, parents like moving out of the home because they were a healthcare professional. I think most healthcare professionals have moved away from that, because we really have seen that the precautions that we take really do work. And again, most of the breakouts that you do see, as Dr. Worth said, in the healthcare setting have been in break rooms from staff getting it from one another, and not from patients, and vice versa. So, the comfort level and the healthcare provider and how their practices are, if they're doing the right thing, would make me comfortable with them coming home with the precautions Dr. Worth spoke of.
Thank you. So as we finish up here, I guess, since I feel like it's different now, Dr. Worth, we've been talking for 9 months. We've been doing this, and our talks have evolved, and they feel like easier to breathe during. Honestly, those first talks we were doing, right, where there was so much unknown. We know so much more. I think now that we have this vaccine, I would be curious to hear from both of you as medical professionals how you're feeling about the next bunch of months. Let's just do a little send off with that. And any other tips that, if you have anything else you want to say.
So I would say it's a mixed message for me. I feel terribly worried about the next few months. I feel as if, at least here in New York City, I'm seeing COVID everywhere, and we're all so sick of it. So we really need to just really stick to these proven practices that we know work, and not let our guard down, because it would be so stupid. It'd be so stupid to get COVID on the eve of the vaccine, right? I mean, just how dumb is that? I mean, obviously that can happen, but so I'm just doing everything I can to try to not get it myself, and not let my patients get it, and hold on until we have this vaccine, which I really think is going to work. And, God willing, in 6 months, it's going to be an entirely different situation, but we have 6 months to get through, 4 months or whatever it is, that we really need to keep our guard up, whatever that takes, whatever that means. Sacrifice things to stay safe. That's what I think.
Yeah, I think for me, it's the first time in a long time I felt hopeful that we're almost there. We can see the light at the end of the tunnel. And I agree. I just, urge everyone to just stay tight, and we're fatigued. Everyone is. We're sick of dealing with this, but we're almost there. And if we just do what we know works, distance, wear your mask, wash your hands, we can get through this. Okay. So to see hope, I see the hope, and I hope everyone else does, and not let the pandemic fatigue get to you before the vaccine, and we see a turn happen.
Well, thank you. And let's see, do we have any other questions out there? I just want to make sure. I'm also going to throw up this, as I thank you both for coming. I'm throwing up a quick poll. If there's anything else you want to learn about, this helps us figure out what kind of talks and classes to do. So feel free to take that for us and let us know what things you're thinking about learning out there. I don't see any other questions in the Q&A at this moment. We have about 1 more minute. So if anybody does have a last question, let me know what's coming up for you. I want to thank you both, Dr. Barhoush and Dr. Worth, for coming and spending this hour with us. I know it really eases a lot of people's minds just to get information from such thoughtful doctors as yourselves. And yes, thank you so much. And everybody can check out, everybody, if you guys, both Dr. Worth and Dr. Barhoush, want to drop in your ads, or we see the new rules of pregnancy. So please check out Dr. Worth's book, The New Rules of Pregnancy. And you can see on social, Dr. Barhoush, and I'll drop that in as well. Thank you, everybody. Yes, people are putting in their information. Thank you so much, everybody, for coming out today. Again, you can follow us at Get Boober, and I'm going to put out the new rules of pregnancy. And at Dr. I want you to write it because now I don't have it right in front of me. Dr. Hela Barhoush, there we go. And thank you for answering all of those questions. Oh, we have an amazing, I see a lot of you are interested in CPR and newborn care. We have an amazing infant CPR class. So I will drop that in the chat as well. And I hope you'll join us. Oh, and all of our gift cards right now get an extra 10%. So for those of you who want to ask your family for the gift of care and support, we would be thrilled. They can help you get a doula, take a class. I'll just drop that here for those of you who's still here. You get an extra 10% of any purchase over 50. So thank you so much, everyone. I'm going to sign us out now. Have a great night or afternoon, depending on where you are, and we'll see you soon. Bye.